Hey, how you doing? And welcome back to this week's video. I'm Dr. Dave, Paragon Chiropractic. I'd like to thank you all for following along. We've had a few comments and a lot of people have been following those last couple videos. So I'm going to try and stay in that same vein. We'll see. This week's video is entitled, If You Really Knew How to Save Your Life, Would You Do It? Good question. If I were to take a poll and ask people what they thought were healthy lifestyle practices, most would tell me that eating well, getting plenty of sleep, exercising, and sunlight were at the top of their lists, right? We all know that. Yeah, everything's great. In fact, when I describe a healthy lifestyle or lifestyle practices to patients and people, most assure me that that's exactly what they're doing. They're eating super healthy, they're doing this super right, and everything else and all the rest of the stuff. They're getting plenty of sleep, exercise, sunlight, all of it. They're doing all of it. Absolutely, Dr. Dave. Good. And you know what? Some recent studies show that this could be the case, all right? A YouGov survey found that 4 in 5 U.S. consumers, that's about 79%, thought that foods high in sugar, foods that were trans fats, or high calorie and low nutritious foods were unhealthy. All right, that's pretty good. What's more, a 2018 survey by Ipsos Public Affairs found that 85% of Americans say they know how to eat right. But 3 out of 4, about 75%, felt they probably could do better and if they tried harder, they could probably be a little more fit. Okay, sounds good. So what's the problem? Right? Sounds like everything's going along great. Apparently people know what's healthiest for them, and according to what most people tell me, that's exactly what they're doing. All that healthy stuff, right? So what's the problem? I mean, if it weren't for the fact that nearly 70% of the U.S. population is overweight or obese, if it weren't for the fact that nearly 70% of the U.S. population is overweight or obese, it sounds like we're all on the same page. So what's the problem? Well, there's only one answer, really. And this is kind of an interesting one. Hate to be the bearer of bad news. People really don't know what's healthiest for them. And on the off chance that they do, most aren't doing what is healthiest for them on a consistent basis. So they really don't know, and they're not doing it anyhow. How about that? True confessions. And, look into your heart of hearts. Are you really doing those things that you know to be healthy consistently on a daily basis? And I'm not necessarily talking about all the stuff you've been told to do, from health class and the gurus and everything else. I'm talking about things that you personally believe to be good for you. This could be anything from gardening to calling your mom more than once a week or taking a nip of brandy before bed. Whether these practices are healthy or not, it's what you believe you need to do to stay hale and hearty. Right? You get what I'm saying there. It's what you personally think you need to be doing to stay in good shape. Are you even doing that? That's an interesting question. Well, now let's look at the other side of the coin. This apparently, like we say, everybody's doing everything right. The only problem is everybody's sick and overweight. But otherwise, we're doing everything right. Okay, so perhaps you aren't doing all the best things consistently, but is it possible on a daily or weekly basis that you are doing things you know aren't good for you? This isn't probably good for you. It's perhaps harmful, maybe even potentially deadly? Do you think there's some of those in there? Well, let's see what the studies say. A recent study revealed that about 85% of those participants in a nutritious diet study had inaccurately assessed the quality of their diets. Right? So they all thought they were eating healthily, but they weren't. 85%. A Mayo Clinic study found that only 2.7% of Americans actually exhibit 4 basic fundamental characteristics of a healthy lifestyle. 2.7%. That is being sufficiently active, that is eating a healthy diet, that is having a recommended body fat percentage where it's supposed to be, and being a non-smoker. The numbers on this, only 47% of Americans are sufficiently active, less than 38% consume a healthy diet, less than 10% have an acceptable basal metabolic, or body mass index, BMI, right? So, wow. And 70% of adults report themselves as non-smokers. So that's it. So most are non-smokers, and I'm sure that just means cigarettes, because now we've got this wonderful where everybody, you can just, I won't get into it, smoking other things than just cigarettes. At any rate, in fact, and this one really got me, only 12% of American adults are metabolically healthy, all right? Which means that they are not experiencing metabolic syndrome. If you recall from some past videos, metabolic syndrome is basically you have 3 of 5 different things: elevated blood sugar, elevated blood pressure, elevated triglycerides, elevated blood fats. Your blood pressure is elevated, and we'll throw another one in there if I didn't say that one, and that's waist size. If you're a male and your waist is over 40 inches, or if you're female and your waist is over 36 inches, American Diabetic Association says you are a diabetic. So there we go. So it would appear that most people really don't know what to do, and if they do, they more than likely don't do it. And instead continue to perform practices and do things that are harmful, if not potentially deadly. That's it. That's why 70% of the population is obese or overweight. Yeah, I know, and this is something that I got to keep coming to grips with. I know I'm a chiropractor, and I should be making videos of grabbing people and cracking the living crap out of them, so it's all noisy and crunchy and all that other stuff. But how can we talk about making popping noises when 88%, like we said, 12% are metabolically sufficient? They're in good shape, right? So 88% have metabolic syndrome, or things along those lines of the U.S. population are very unhealthy with the prodromes of those diseases that will ultimately put them in an early grave. So if you look around, if there's 4 people standing here, one of you is probably okay, or maybe half of you is okay, the other 3 aren't. How about that? That's something to really think about. So here we go. So what should you do, right? And this is something that we'll get into here a little bit. So if you're experiencing chronic pain, which is defined as pain that persists or is recurring for 3 months or more, know that this is due to uncontrolled and unresolved chronic inflammation. Plain and simple. This is inflammation that does not shut off, continues to destroy the body, breaks it down, and makes pain. In the next video, I will talk about the power of intermittent fasting, a couple other $25 words that we won't use right here, and fasting in general. And I guarantee it will blow your mind on what you're able to do with just not eating for certain periods of time throughout the day. I mean, amazed. Yeah, you'll definitely want to do it. In the meantime, if you are experiencing pain that simply will not go away, here's what I recommend. I like this product here, Ultra Inflamex 360. You'll see here it is considered a medical food. What that means is nowhere on this bag is there anything from the FDA that says this has not been found to treat or diagnose or anything with disease. This is recognized by the FDA as something that you can use or eat or do to treat a disease or disorder. So what I recommend is that for basically coupled with these SPMs, which you've seen, They used to be pretty darn expensive. They still are, and you needed to take 6 or 8 of them a day. Now it's only 1 or 2. So what you want to do for 2 weeks, this would be your only food with that intermittent fasting, and you would take 1 to 2 of these for that 2 weeks. This will get rid of your chronic inflammatory pain. That is pain that has been persisting or recurring for over 3 months. It's driving you crazy, right? That's what this will do. In the end, you'll probably lose 20, 25 pounds. It's going to seal your guts, and you will come out of the other end amazingly healthy and out of pain. Good. I mean, you simply can't go wrong. So let us know. You can pick this product up here. We've got ways that you can order it online along with the SPMs. And we'd love to show you how to do that. And good. All right, so that'll do it. If you think about it, hit the subscribe button, hit the like button, make comments, talk to me, tell me this, that, and everything else. And we'll see you next week with the fasting video. All right, take care. See you next week.